2021 Dallas County School Board Work Session to order. Let everybody know that Miss Gwen is enjoying vacation this week, so we'll not have her today, but everybody needs a good vacation, so glad she's able to do that. Go ahead and make a statement that if the board decides that we would need to have a closed session, discuss personnel matters, we reserve the right to do so. And with that, go into the first regular working session item, which would be review of the draft back to school plan. Dr. Arbogast, I have these in no particular order. If you'd like to address any of them before we get to this one, we can certainly do so. But I think we've all looked through this draft plan, and I don't foresee it going very long. If you want to go ahead and knock that out.
That's fine. I didn't know which if you want to go through the stuff that's going to take less time, but we can start with that first. It's fine. As you know, about 2 weeks ago, on the 21st, we received updated guidance from VDH DOE regarding mitigation plans and prevention of COVID-19 for pre-K-12 schools. That information has been shared with you. We have provided a draft plan to you. I shared information with you from the planned, the updated mitigation, what my thoughts were, what the recommendations would be. But after talking with you and talking with and hearing about community feedback and that sort of stuff, you've been presented with the proposal that you have in front of you, or that you provided probably last week and this week updated. Just to walk through it, everybody knows we're going to be resuming in-person instruction on August 23rd under as normal circumstances as possible. State Health Commission public order requiring masks that was in place for indoor instructional settings in Virginia that expired on July 25th and has not been extended at this time. So each school division has been given the ability to implement a mitigation plan that utilizes layered levels of prevention. VDOE and then VDH, they recommend physical distancing of at least 3 feet. Should be maximized to the greatest extent possible, but schools should not reduce in-person learning to keep a minimum distance requirement. We anticipate we will continue to work with the Newber Health District and with regards to the CDC and the VDH's guidance on reopening schools. We'll look at take following steps in decision-making about prevention strategies and school operations. We'll look at and evaluate the level of community disease transmission. We'll understand the community level of vaccination coverage, and we'll consider the level of impact to a school. We'll understand community and school capacity and needs, and we'll determine and implement a layered approach with multiple prevention strategies. As we all know, masks recommendations continue to be discussed at both the federal and state levels. Currently, VDH and DOE recommend that everybody wears masks within the classroom and other indoor settings. The goal of the plan that you have been provided and that we want to implement is to maintain the safest environment possible for all of our students and staff. And we would like to have a 3-phase approach to that plan as outlined, and I'll walk through here as well. And again, this plan will be dependent on the information that I shared with you prior. So phase 1 of our plan, which I would anticipate is what we would start the school year out under, unless there are concerns and there are changes or alterations that we make today, but I would assume we would start under phase 1 for our upcoming school year. We know that masks are required on school transportation for all students pre-K-12 and staff, regardless of vaccination status per federal guidelines. So that's a mandate. The mask would be required on school transportation. Masks for students within the school building would be recommended, but would be optional based on personal choice. Masks for staff members.
What does that mean? Will they have to sign a release? Is that when a parent chooses their child not, to have to wear a mask? Will the school have to be notified about a release or something?
That's a conversation we could have. We have not had that conversation about creating a release for all 2,200 or 2,100, 2,300 students to sign.
I mean, how would they know? My mom said I don't have to wear a mask. I mean, you know what I'm saying? I mean, I don't know.
I think, Mark, and I thought about this too. If the parent says they want their third grader to wear a mask, if the third grader rolls in and takes it off and says, Mom said I didn't have to, or Dad, do we need to have an option for the parent to send something into the school saying, I want my child to wear a mask? We can talk about the logistics of that, but.
Basically have an opt-in instead of an opt-out.
Right.
That may be simple.
Well, it's got to be communicated to somebody, yeah, one way or the other.
Like the teacher needs to know, little Johnny or little Susie, the parent wants them to wear a mask, and they need to make sure they wear it.
I think just conceptually, to me, it seems like it'd be easier to have an opt-in where someone's concerned and wants to make sure their kid's wearing a mask, then, contact the school and have that versus,
Right.
Since, that would be, I'm anticipating that would be the probably the minority of our students coming in anyway, based on feedback I've been getting.
Yeah, that's a good point.
What do you think?
That's what I think.
I always hate when people ask what I think. Well, I just think that if you're making it optional and a parent's choice, they want them to be worn, and if a student doesn't, and the student flat out refuses, then what are you going to do about it? Are you going to expect them to be punished, or just a note to mom, or, what I'm saying, like that, then what are you going to do if a child's parent wants them to wear a mask and they get to school, they're the only one with it on, and they don't wear it, then what are we going to do about that? That's my question.
And that kind of brings you to like, what about, especially younger kids or any kids eating their vegetables at lunch or that type of thing.
I mean,
That's a sticky wicket, because you can't.
well, we can't make them go virtual because that's a sign up and you have to qualify.
That's right. We had that
You
option
gonna-
last year, we don't. this
Yeah.
year.
We don't have that this year.
They're not breaking a board policy.
I don't think they're breaking the school policy.
They're not breaking a school policy.
I think it's gotta be communicated, hey, this is what we've got,
I mean, the teacher can let the parent know he's not wearing his mask. I mean, that's basically
Yeah.
what they could do.
So, what else can you do?
I mean, it's,
I think it's a simple, I don't think we need to make it
Yeah.
complicated. I think that's,
but they're gonna ask that. And like, if you have them opt in, then the teachers are gonna want to know, well, they're refusing to wear a mask. What do you want me to do now? Because I can't keep him, we're going outside on the playground and he takes his mask off. He won't wear it. What do you want me to do?
I think in that case, just let the parents.
Just let the parent know. Those things need to be communicated with the
Right.
teachers because they're gonna want to know what to do about that.
okay.
Because I don't think you'd want to discipline the child.
No. Okay.
In regards to masks for staff members, the masks for staff members within the school building, again, are recommended for all, but will be optional for those vaccinated staff members and will be required for all other staff members. Some justification for that is everybody realizes the difficulty we have getting substitutes for our staff members. We could lose an individual if they were to test positive and to have to go in quarantine. We could lose an individual for up to 10 days. So that would be an in-person instruction that we would lose, our students would lose for our students. And we are focused on in-person instruction to start the school. I mean, this school year, that's what we've been mandated to have in-person instruction, so, we need to again, try to have everybody there as best we can and as much as we can.
But aren't you singling these people out by making them wear a mask?
You're just talking about substitutes.
You're just talking about,
I'm just talking about teachers.
you're talking about teachers.
Yes.
Well, you're talking about any staff member, you're not just talking about teachers.
Just any staff
Yeah. It's really has nothing to do with their belief or their for the vaccination, against the vaccination, or anything like that. It's about making sure we can provide in-person instruction the best quality for our students.
I understand that, but still, I don't know how many teachers know which teachers got it and which teachers don't.
Yeah,
I just think you're gonna cause a problem there.
Would you, the thing I was thinking, for phase one, would it be optional for all? I mean, at that point, we're in kind of what at least locally, I think we are now in a good situation. You might be more concerned if transmission increases, you know, and let me say, I think you've done a good job putting this together thoughtfully, but, you know, I think that may be, I would be fine with that.
To me, phase one, to me, I don't like the mask period, but.
Yeah.
And I think if you start making people wear masks and just keep everything simple, everybody needs to wear it, whether you vaccinated or not. That's just my opinion. But there again, I hate the things to begin with.
I think I get where you're coming from, Dr. Arbogast, with protecting their staff, is really what your intentions are with that phase one. I think we're probably setting ourselves up for some complaints because we're giving one group of folks the option to not wear the mask even if they're not vaccinated. Then we're turning around and telling a different group they're gonna be treated. The intention is good, I get it. So I'm not saying that wasn't a thoughtful consideration. I think my thought is phase one is optional. That's just one board member felt, I think that's where you are.
I concur with that.
So can we make that change?
certainly. So be masks for staff members within the school building, recommending for all, but are optional for all staff under phase one.
Do you feel that we're putting you in an uncomfortable position by making that change?
No, I don't necessarily believe so. Again, it was about one, safety, two, the in-person instruction is what we're trying to, again, to have the safest environment for everybody.
If we're into 10 or 15 substitutes the second week, then you would say, well, here's that one, Dr. Arbogast.
Well, if we see it's going to blow up, yeah, just
Put them on anyway.
Yeah.
Yeah, because I'm sitting here thinking as we're having this discussion, it's almost like it's green or phase three. You know, phase two seems, yeah, well, as we go over that, you know, because of the thoughts of, okay, especially the students trying to manage that with the, I'm trying not to get ahead of you, but that's kind of conceptually where I'm seeing is, you know, are we going to require proof of vaccination and go into that for those? So that, a lot of issues. I mean, like I said, I think this is a very well thought out plan.
Well, and the key word is recommend. I think we highly recommend you wear these masks. I think that may be it.
And we stated further at the end again, that again, if somebody wants to,
Right.
wear a mask, then they continue to wear them if they want to. That's up to them.
We're gonna have that available till the end of the decade.
Yeah. So,
So that's the only change I think we have on that phase one.
okay. We still talk about the correct hand washing with physical distancing of 3 to 6 feet to be done to the greatest extent possible. Again, regular cleaning schedule to be continued throughout the school day. Encourage anybody that's sick, have fever of 100 degrees or more, et cetera, to stay home. Quarantine and close contact, we talk about that again. Individuals that are within close contact of any positive case will follow the CDC and VDH guidelines. Now, there is an exception that they added to close contact for K-12 settings for case investigation and contact tracing. If they're indoors, a student who is within 3 to 6 feet of an infected student is not considered a close contact as long as both the students are wearing masks and the school has other mitigation strategies in place. However, that exception does not apply to teachers, staff, or other adults in the K-12 setting. School visitors will be limited within the schools by appointment and will be required to wear masks when entering the school building, and visitors will not be allowed during lunches and will continue to have the isolation rooms maintained by each school.
So why does that exception not apply to teachers, staff, or adults? If they both have a mask on, they transmit differently than to younger adults, is that what the?
I believe that's what I assume that's what the rationale is behind it. But that's part of the guidelines that were released.
I don't know how I can be sure about that. Something. The only question I had about the quarantine and close contact, I know this was kind of a ebb and flow thing last year, but who does the contact tracing? And don't tell me it's their principals and vice principals. You?
It's going to be it's going to be information sent to Jesse from the school through probably the school nurse or the principal, and then it'll come here, and then we'll backtrack it with the health department.
And you have time to do that.
Well, I mean, that'll be a main priority. You know, I will have to prioritize that first, like we did last year. I mean, it's quite consuming, but I will.
Do we need to use some CARES Act money to put somebody in charge of doing that, and that'll?
I mean, maybe something to consider, but.
Or do we play it by ear and see if you start?
I think play by ear and see, you know, how it goes. I mean, with the help of, we got in a good process last year with, you know, Jesse and I working on it with the help of Holly Lesko. So, you know, let's see how that goes, but.
And to the extent possible, the more we can put that decision over on Holly or a VDH person.
Mm-hmm.
We start getting parents coming in here saying, I don't agree with what you decided. What's your medical background?
Mm-hmm.
We need to keep our staff out of that situation as much as possible.
Right, and what Jesse and I found helpful to do last year, we learned our lesson a couple of times, is that we put it in writing to Holly and she will respond in writing.
Perfect.
So we have that. If we think it's going to be confrontational or controversial or it deals with athletics, you know, that's usually the hot topic right there, is that we will put it in writing to Holly and she's very good. She'll respond almost immediately.
All right, that sounds good.
Other comments, questions on phase one?
The only other thing I had at the very beginning of disease, word maybe. It doesn't make any difference.
Where are you?
With level of community disease. I hate to give COVID too much credit.
That's taken basically verbatim from what's included in the guidelines.
Okay. I don't know, it's so bad.
Yeah, you probably are. It is a disease. And a cure, you know,
The first paragraph of our grab list there, right after expired July 5th, 2021, is not.
Oh, should be Ben.
Make that Ben.
Yes, sir. I forgot to correct that again.
So we'll go back.
Phase two, again, to move to phase two after reviewing local health information, looking at how it's affected our schools, looking how it affected our students, staff, absenteeism, et cetera. Conversations with VDH, or excuse me, our local New River Health Department, that sort of thing. We could move to phase two. We would continue whatever mitigation strategies we list in phase one with the following additions. Again, masks would be required on school transportation for all students, pre-K-12 and staff, regardless of the vaccination status per federal guidelines. Masks for students within the school building are recommended for all, but would be required for those students that are not vaccinated. Masks for staff members within the school buildings are recommended for all, but again, optional for vaccinated staff and required for all others. Again, physical distancing, 3 to 6 feet would be done to the greatest extent possible. Regular cleaning with additional measures added. School visitors would be limited again within the building and not allowed during lunch. And then we would begin the temperature screenings to be conducted as for students and staff as they arrive to the facility.
We're gonna ask for vaccination cards.
You can.
I still say just 1 and 2 is about the same, you're still gonna have problems. Especially you're gonna have more problems, in my opinion, with kids that's not vaccinated, have to wear a mask, and the kids that are, that don't have to wear one. Granted, there's probably not gonna be that many kids that are vaccinated, but still.
I just don't know how do we police that?
It's the honor system.
So it's basically the honor system. That's what it.
So really, there won't be much difference between phase one and phase two.
Unless
Teachers may be a little more diligent.
Unless we require some sort of proof of COVID vaccine, and then we get into if we do that, then the challenge becomes adhering to HIPAA.
Almost violating HIPAA each time by having the mask on.
So.
And then you're looking at basically every K through 7 student having to wear a mask under, unless they've got some, as it stands right now, that's not approved for the vaccine.
So really, phase two is just, it's proper policy development is what we're doing. And essentially, we'll go to phase two, and it may only last for 3 days.
Maybe.
And we'll say, well, we're going right to phase 3.
Good.
Or you could go 1 straight to 3.
Or you go from 1 straight to 3.
The biggest conceptual problem I have is with phase 2. It's almost something that it's just going to be practically impossible to enforce.
And Phil makes a good point. If we try to do something in between 1 and 3, are we going to cause more problems than teachers and administration want to deal with? Because then people are going to start accusing others of not wearing them, and I know you didn't get vaccinated. Now you don't care about the school, and we're putting some pressure on different groups of people to be self-policing. Maybe the world needs more of that. I don't know if we want to use our school system as a testing ground for that. So, is there any benefit to going to a 2? And is it a buffer? I don't know. Maybe we leave it in place and know that it may not be very effective. We go to 2 for a week, and you say, well, we're still not. We're not getting around it. We're going right to 3. I think it gives the community a little better feeling that there's a slow transition. It may not be reality, but this, having a phase 2 is in your face.
It's going from 1 to 3. Mm-hmm. It's a slower transition, even though it may not be a legitimate transition.
I think it's probably going to be received like this. I think we all agree that in practicality, it may not. But for managing panic and perception, I think we leave phase 2 there. It's, be great.
Maybe you could look at phase 2 as classroom situations, where phase 3 is more of a school-wide. Like we had instances last year where there was a set of children in one particular classroom. And so maybe it would be a good idea to, have those students I don't know, I'm just trying to think what we would use phase 2 for, but instead of being a county-wide, school-wide thing, maybe.
I like it just because it makes better.
Yeah. And the other thing you have to be careful about too, because I've thought a lot about this, like if you have a list of students that are, that are vaccinated, and that classroom teacher is going to know that, but when they go to the gym or whoever's doing lunch duty and stuff like that, like they interact with a lot of different individuals that they're not going to pull out the vaccinated list. That's another reason that it's going to be really hard to police too.
Can we have the vaccinated list? If Jesse has that, so we can track whether or not it's.
That's part of the, and that's to take a step back to phase 1. That's part of the reason that some of that information was in there was for Dolly, is because under the new proposed Dolly standards, employers are required, shall provide and require employees that are not fully vaccinated and otherwise at risk employees to wear face coverings or surgical masks while indoors unless their work task requires a respirator or other PPE. So such employees shall wear a face covering or surgical mask that covers the nose, mouth, etc. So that's part of the reason why that was included there as well, is because of some of the anticipated Dolly.
Do we have a list of kids that have been vaccinated?
That doesn't say anything about kids.
Well, all I ask is if, for tracking data, to know whether or not their problem is only in unvaccinated population, or if now, it doesn't matter whether you're vaccinated or not, it's still spreading. For us to internally understand that, we'd have to have a list of who's. So when we get a case, is not that it'll be public, but Jesse would know, yes, who was vaccinated and is still.
She can pull it off of the, there's I can't quote you the name of the
Okay.
the
And I don't need
platform.
for us to use that for anything other than to track how it may be spreading through our buildings. That's it.
She would be able to share that with the VDH
Got
if they wanted that.
And I just hope we don't come to complacent as a board, as administrators, and I'm sure they won't, and get too relaxed because, with this recommendation of not wearing a mask or wearing a mask or whatever, that we let this come back, So please stress that, because it's not, as you see everywhere else, so we gotta be mindful of that and take precautions every time we can, clean and do what we can, so that's my biggest fear.
So, what you just said about Dolly concerns me greatly, because the fines they have, we would have to pay. If you're telling me that as we sit here right now, that we're gonna be required to have non-vaccinated employees wear masks inside, and that's every employer in Virginia.
Based on what the proposed standard changes are, and that's what's been shared with us. Now, is that gonna change through public comments and that sort of stuff? I don't know.
Just let us know if it does. That would change my opinion of it, just because Dolly scares me. It should scare all of us.
And actually, I think, what's today, the 3rd? I think yesterday was the finalization day for them to get the comments and that sort of stuff through yesterday, so.
So related to that, Dr. Arbogast, if we stood our ground on phase 1 allowing teachers to not wear masks, even if they're unvaccinated, would them signing something relieving us of the Dolly responsibility piece, is that even legally worth the paper that it's on?
I don't think so.
It would be like, same, it's kind of like OSHA regs with, you know, you can't have an employee waive an OSHA reg.
It's just gonna put us in a sticky spot because I think Philip's right. I think that the change we made is the right one, but it's gonna be, if we have to put it back on that requirement, where our hands are tied, and that's not a we recommend. Doesn't sound like the language is gonna say that.
No, I think,
It's gonna say require.
yeah, because if we get an outbreak and they come in and we could get a fine, just like OSHA gives a fine, Dolly could give us a fine.
Oh my gosh, I guess, let us know.
And check with council just on that, if you can, just on that point, what liability.
If they could sign off, I'd be fine. They'd say you do what you want, but we can't get out from under that legal responsibility. We're gonna have to think really hard. Phil, are you all right with phase 2? Even though it's kind of some with, some without?
No, I'm not all right with it, but y'all do what you want to.
I mean, that's why we're having this meeting. So you'd rather have this and then straight to phase 3? No phase 2?
I just think it's gonna cause more problems. Teachers are they're gonna be taking care of kids. Why ain't this kid got a mask and this has got one, then you are teaching?
I don't think they'll be able to police that any more than they did in phase 1. You know, I don't think it'll change much. We'll say phase 2 and same people will show up with the same mask and the same will show up with that.
No, teachers shouldn't have to police that,
No.
that they could.
All right.
Phase 3, again, based on data, community data, school data, that would dictate us transitioning to that phase. Again, we would continue the strategies under phase 1 that have been talked about. Again, continue masking requirement on all school transportation. And staff, no matter whether it was students and staff, regardless of vaccination status, and we would move to would move to limiting number of students on transportation, because we'd have to start spreading them out if we got to a point where we'd have to go to phase 3. Masks for students within the school building would be required for all. Masks for staff members within the school building would be required for all. Physical distancing of 3 to 6 feet will be maintained. Regular cleaning schedules continued throughout the school day with additional measures to ensure that the high touch areas are being cleaned in between classes. No visitors will be allowed within the school building. Temperature screenings will be conducted for students and staff as they arrive at the facility. Isolation rooms again, and then we would have to, if necessary, consider remote learning to limit exposure and enhance learning, if need be.
What does that plan look like? Remote learning. We go back to our teachers taking on virtual again.
If we have to go to remote learning, we wouldn't have, if we're remote learning, I doubt we would be in school. So they would be doing whatever instruction remotely, as they did last year, using the platform.
We better start talking about what that looks like sooner than a couple of weeks before that breaks loose, because it needs to be a lot smoother than last time. And that's no fault of anybody sitting in this room. But Lord help us, if we get to that point, we better have a plan that we roll out pretty smooth and people know what that looks like before we get to flu season. That's just me personally.
Well, and it should be this year easier, because we're not having the hybrid. So if we have a period where, you're basically saying we might have a period where we need to shut a building down or shut the schools down for a week or two.
Or class down, or whatever it may be.
You know, we should have all our teachers prepared to be able to get on Canvas or whatever tools they're using and have that contingency plan. I mean, we ought to have that contingency plan in case, the building burns down or something like that.
I mean, and they're gonna need to have that plan anyway in the event we have inclement weather, because that's what we're gonna use. The snow inclement weather day is gonna be a virtual day as long as power and that sort of stuff. We have that ability throughout the county, and they've taken their technology home with them to be able to do the one-to-one. Then that's what we're gonna use the virtual day as a day to make up.
They're aware of that already, so they know that,
Well, I think.
Just need to, they can be reminded.
That's another discussion, but I don't wanna take the snow days from them until it's gonna have days to the end of the year.
First 5 add days. So if we don't count them, I mean, so if we, I mean, that's
So the first 5, period, add.
that's what we're required to make the first 5 up.
So after 5, those first 5, we got some flexibility.
But if we're not, I don't know if I understand what you're saying. You want them you want us to leave snow days and make up the first 5 and then after that do virtual, or? Well, I'm just asking,
Kids still, they need to be able to be kids. I mean, snow days were some of the greatest memories I've got as a kid. Maybe they don't go outside anymore. I think a lot of them do. I mean, I don't want to add days to it, but I still would like for them to be able to have a normal school life like the rest of us to some extent. That's enough.
I understand.
That's all, man.
Okay.
Yeah, and I guess the only other concern I've got, probably more concerned about, last year we did the hot spots and got that, I had that last year, but do we have that in place this year?
We have, again, working with T-Mobile, we'll have 500, up to 500 hotspots available that have 100. Each one will have 100 gig total. So you run through one, use 100 gig, we can transition another one. So that's what we have available right now, or we will have available.
Let's hope we don't have to do any of that.
Do we have all the numbers of who's gonna be virtual full-time right yet?
Right now, I think we have 22, 24, somewhere in that neighborhood that stated that they're gonna be full-time virtual. But I anticipate, and I could be wrong, that we have some that were waiting to see what this conversation was today and what the requirement was gonna be for masking. But again, I could be wrong.
So you think it'll go
I think if
towards more?
I don't think it will. I don't think it, the way it is written, I mean, the way we're talking right now, I don't anticipate that, but I could be wrong.
Never got anything else for phase 3? Comments or requests of changes? Bill, Mark, Jason? Okay.
Okay. Just there's some additional information there that, again, mitigation strategies move from one phase to another to meet safety and or instructional needs. We are looking into doing screening testing, and that could be offered for students and staff members depending on the prevalence within the schools. We've had conversations here, we've had conversations with the health department. That could look like, for example, just symptomatic and unvaccinated individuals, having a list and doing those. Testing, it could be looking at if the community prevalence or the school prevalence got high, or if, let's say 5% or higher, we could look at unvaccinated staff, unvaccinated students, 10% of them to do per week. Or when we look at indoor sports, if a prevalence occurs within a school that's higher, 5% or higher within the school, we could possibly look at indoor sports and test unvaccinated students as well to help with limiting and keeping the pandemic down within the schools.
Is there a way to do vaccinations at the school with them to get some, if there are new people coming in, maybe?
I think we offered the opportunity last year. I think we would continue doing it if the health department was interested in doing different opportunities, and it just will be challenging with having the kids all there and staff there, so.
Down there? No.
You're talking about the health clinic?
Yeah.
I'm sorry. The health clinic, well, they're working on the room now, and that's, the information's been posted, and that's out there right now.
That's what I'm doing. It's
so-
the health clinic has availability for the shots and we advertise it.
That I don't know whether whether they're gonna have the ability to do vaccines or not. I don't know that. I had not asked that question to them. I'd have to look at the
I think
form.
that'd be a great tool to have them down there and say, hey, we got these shots, if, you know, that would, you know, and tell them about who's going to give the shots and where at.
If you do the screening test, he pays for that.
There's a grant that we'd be participating with.
Is there a group dedicated to our 6 buildings, or does that group flow through the district?
I believe we would be assigned a group, and that's who would work with us.
Okay, so we'd have access to them any given day to go to any given building and do.
Be my understanding, but I don't know that there's also, from my understanding, funding that's available to hire somebody that could help oversee it within our division to kind of coordinate between us and that entity. But again, I've not seen how much funding we're talking about.
We know that before the 23rd?
Don't know that we are, because I've not heard any more.
Applied for the 1st of July, right? Is that the one?
Yeah, we notified them, but 1st of July that we were interested, but I've not,
Okay.
I mean, I've seen an email that talks about that they're,
I think that can be a pretty good tool for us.
Yeah.
To just understand where and what really happened.
Again, if individuals want to wear a mask, they can continue to wear that at schools. That's up to them. We will have masks available at schools. We'll update athletics, extracurricular activities, and other school activities when necessary. Schools are encouraged to use outdoor spaces if they have some and when possible, because again, masks aren't necessary outside. And again, just a reminder, everybody, masks are required on the school buses, pre-K through 12, no matter whether you're vaccinated or not, student or staff.
That screening, is it just for unvaccinated people?
It depends on how we set it up. Whether
Symptomatic.
it's symptomatic. Could be symptomatic or an unvaccinated contact testing. It could be test 10 to 20% of unvaccinated student staff per week when community prevalence exceeds a certain percentage. Could be when a specific school exceeds a percentage of prevalence, that 10 to 20% of the unvaccinated students and staff in the school are tested weekly for a period of 14 days. Or you could, I guess I said, indoor sports, unvaccinated students only. So it depends on
And I see it as a tool if we have to shut down an entire classroom because we don't know. We can do the testing and determine that it's only 1 or 2 students and that class can keep going. Same thing for extracurricular activities, programs, settle, because DHSL is not gonna back down. They're not gonna give anybody any relief this year. So if you have a team that can't travel, you take a loss.
I've not heard any.
We get the test, you come there and find out it's only 2 athletes. The rest of them get on the bus and go. So I think it's a good tool to have. Whether we like it or not, I don't like it any more than you do, Philip. We have to figure out how to play within the ridiculous rules and guidelines that we have and help the kids have the most normal experience possible with everything inside that school system. We can go out as adults and fight and run those battles to try to change that, but these two or three classes will have gone through our system before we figure out how to get our hands around what's really going on. We have to give them normalcy as best as we can.
The way they describe the test, it's not the test like if you go have surgery, it's more of a even, or operating on you, it's more like they said, even a kid, like the nurse could hand them the swab and it's just right inside the nasal passage. It's not the full touch to your brain.
It don't go to the brain.
Doesn't go to the brain.
Doesn't go to the brain, so it's a little bit, it's not as invasive as what,
So is that something we send out with the initial packet that says you need to let us know if you're okay with us testing your child for any
Again, it would have to be,
reason?
it'd have to be opt-in, I believe, or they'd have to be able to do it.
So that'll go out with the first year.
If we have paperwork, it would.
Okay.
We'd send it, we'd have the copies at schools and post it online and.
I mean, every athletic event, the coach should probably push that again. We can't test them if they don't let us, right?
That's correct.
So that could be where we run into some. And I got kids, I'm all for people saying I don't want my kid testing, but we need to get as many of those as we can. Because we gotta start getting permission in the middle of trying to figure out, and damage is being done while we're trying to get all those permission slips, but we're dead.
The way they described it, it's like, say, the volleyball team, for example, we were playing for the championship. You test, it's a anonymous test, like you test them all, but you don't know who they are until if you get a positive. Then if you get a positive, then it's an
Then you
individual.
start an
So
individual.
that answers your question, Phil. It's not just
No, it's,
unvaccinated, they test them all.
Yeah, to me, they all gotta be tested, whether
Yeah.
they're vaccinated or not.
yeah,
Well, now vaccinated people are getting it, so it doesn't make any difference
Right.
whether you're vaccinated or
Yeah.
not.
but you test them all. If it's negative, you move on. If it's
Got it.
positive, you do individual testing until you find the positive.
Okay,
Then you do the contact tracing from there.
got it.
Now, if an athlete doesn't opt in, then then that's a different question, and then, but.
But it just concerns me too about false positive for if we end up kicking the whole team out. I mean, if we're doing testing for our athletic teams, and we've seen that, I mean, look at Nick Saban this year, false positive, or one college football coach. I mean, if we're doing that not in response to symptoms, I don't know that that's not adding additional risk that maybe other school systems aren't putting on their student athletes.
Dr. Bissell is recommending only symptomatic students,
Yeah.
or if you've played a
Yeah.
team and they're like, oh, we exposed you and it's gonna keep you, but it's just like not random testing just to be testing. It would have to be if you have symptomatic
All right.
students, athletes.
I just don't want to put our system students at a disadvantage.
No, yeah,
It's something that may not improve
Right.
their safety.
yeah,
I mean, I think we would only bring that in if It's absolutely necessary to keep us from telling a team they can't go.
Mhm.
Anything else for Dr. Arbogast or Ms. Mustaine on this plan?
I want to make sure I understand what the changes we need to make to it.
Okay,
One, we're under phase one, and we'll carry it throughout the rest of the document. We talked about the masking of students, that's optional. But the parents need to communicate with the schools that they need to that they want their child to wear a face covering. And if their child is not wearing it, then the school needs to contact the parent and just let the parent know that it's not occurring. So that statement will be added in there. We're changing staff under phase one to optional, all staff, as long as, or depending on what we find out from from council for the Dolly questions.
and if they're gonna relieve us of legal responsibility in any way.
I'll ask those questions and get an answer as soon as I can from him. Otherwise, there was a couple a word here and there, but otherwise I don't have anything else to add or to change unless you tell me differently.
I did a good job putting it together, Dr. Arbogast.
Very well thought
Thank you,
out.
thank
Yes,
you.
sir.
It was through conversations with other divisions as well, so we, and look at what they had.
Similar to Bradford and other.
It's comparable to others,
Okay.
to some of the others right now.
Dr. Arbogast is being modest. It was Dr. Arbogast's idea on a call, and other people have modeled after his idea.
Thank you, Ms. Mustaine, for that.
You're welcome.
Yeah, you did a good job. I don't mean to be the bad person here.
But I don't take it as a bad person or anything. I just, we need to have a conversation about it.
Situation, what you do, so.
Yeah. We need to make
No
sure.
right answers.
Yeah, there's nothing, yeah.
And we're starting off the best we can, telling everybody it's America, you choose. And that's all we can do to begin with, and we'll just have to see what happens.
And we just need to remind, and everybody needs to remember to keep doing the things that they were doing, washing hands, hand sanitizing, and being as safe as they can, and we'll keep on moving forward.
All right, next thing we got is just a quick update on teacher positions. I don't think we get too far in the weeds, but just, we're getting pretty close to game time. Are we doing okay?
Depends on what, you consider okay.
We're gonna have classrooms with teachers.
We're gonna have classrooms, we're gonna have students in our classrooms, and we are gonna probably have some positions where we're going to have substitutes in those positions.
How many are we talking right now?
I'd hate to tell you for certain right now, but I do know that we have at least 3 special ed teaching positions that are currently vacant. We have an early childhood special ed position that's vacant, a school counselor position, 2 speech language positions, which we may need to think about contracting those out, because I don't know that we're going to be able to do much right now. Middle school teachers, we have 2. But I think we have a plan in place that possibly could do long-term subs for those positions. PE, health and PE position, Spanish position, math position, Title I, school social worker, 1 reading specialist, and then we also have a secretary and at least 3 TAs. But again, some of these will be interviewed, hopefully between now and the start of school, and hopefully a couple of them will be removed. Because there are some applications that have come in here over the last week or so that hopefully maybe we can get interviewed and see what possibilities we can have.
Okay, maybe I shouldn't put that on the agenda. I mean, we need to know whether we're facing.
That's what we're facing, and it's tough. I mean, this year is worse than others.
Is that the virtual with Stride, virtual Virginia, that stuff?
We have lost some teachers to the virtual platform. So that's been some of it. We just need to keep, we know that, we've got work to do on our salaries. We know that, and we need to continue to work on that.
Other localities that are paying more aren't having as much trouble filling positions as we are.
Don't know that we can, because and again, I won't be able to quote you. I heard it this morning on the news. I want to say it was another school division, Botetourt or somebody like that were also had 9, 10 positions at this point in time. But I don't know what they're paying.
Retirements, or, you don't know.
That could, and we've faced that too. We've had several retire, we've had several resignations. It's.
But I know several across the mountain, bigger pay.
Yeah, so, it's been tough. It's been tougher this year.
What do you need from us to make that better than just flat out lack of interest? There's nothing we can, bonuses, or at this point, I don't know if that causes more problems.
I think we can't, it's hard to do, put somebody in these positions if we don't have individuals to interview, and two, if they're not certified to put into these positions. That's the dilemma that we faced. That's the dilemma that we faced. And again, as I said, there's a couple out there positions there that we have had a couple here that apply here in the last week or so, that maybe that they are certified and we can get interviewed and get into place.
There's some positions that don't allow a provisional.
Yeah, and there's some positions that we can't put individuals in with a provisional, so it's just.
But I think we've got to address
And I think we need to keep that in the back of our mind and keep addressing that and keep trying to move that forward. And as we do that will hopefully alleviate some of the issue. But again, we saw it coming 5, 6, how many years ago it was, that applicants just weren't there. The pools that were beginning to dwindle.
Well, the scary part is, it was further back than that. The prestigious teaching schools were telling us they were seeing a dramatic reduction in enrollment. So that blip on the chart hasn't made it here yet.
Mm-mm.
And then then we can offer all the money we want, and there won't be any teachers out there to accept it.
I think it has, and again, we've talked about it, and it doesn't do much good to keep rehashing it, but this past year, I know with the pandemic and that sort of stuff, we transitioned from in-person job fairs to virtual job fairs. But we held a job fair, we didn't talk to anybody. At least 2 of them, job fairs that we participated in. Nobody at all. And again, granted, that could be a combination of the newness of moving to a job fair that's online and not understanding how to schedule, that sort of thing. We'll see if that continues, but again, we knew the numbers were dwindling just pool-wise, and it's really hit.
Can we get the compensation committee going again once
We can, once
get back in?
once school year gets started, we can get the compensation committee back together. And I think that's what we.
Extremely important to show them that we're staying on top of that. And there's some new board, at least one new board of supervisor member, Mr. Martin, that wasn't really aware of all of the discussions that we had about potentially using pipeline tax money. So getting that going again and making sure all the new players know what we would like to do, at least $1 million+ of those reoccurring tax dollars would be helpful.
Well, once we get back into school, we'll work on trying, once we get back into a little bit of normalcy after the first week or couple weeks. Update on the facility projects. paver has been, company has been out at Giles High School track. If you've not been out there, they have cut out along the inside lane to extend it a little bit for the asphalt. They have put the stone and compacted stone down around that. They put in the path of stone is in there ready. Maintenance was working on the drainage line. They were working on that again yesterday. I haven't talked to them today. I don't know where they are, but as soon as that drainage in front of the home side gets put in, Lincoln will be able to get in there and be able to pave the track and get that done. I've not heard from Adam, Joe at the tennis courts. They're both on, been communicated with Adam and ATC, just waiting on the date back from them and when they're gonna be able to come. They have the colors for the paint, or not the paint, but the finish for the inside the tennis court and the exterior of the court. So that's been communicated with for both schools. And now it's just a matter of waiting on, seeing when he's gonna get a date and tell me what the date that they can do it. The other one, just Nares Elementary HVAC boiler, had a non-mandatory pre-bid meeting. I want to say it was last week. Might have been the week before. It was last Tuesday, the 27th. We had 2 groups there. But again, it's non-mandatory meeting, so don't know if there's others. August 10th is our bid opening, so we'll know August 10th, have a better idea of what the costs will be and that sort of thing.
Did you get
Next
them
week.
just to let you know how many are on the plan holders list?
I can ask
That's a
them.
way to understand how many actually have looked at the plans and maybe didn't show up. I'm just curious if it's, because we had a pretty big project that we just had put on the street. We had 12 contractors interested. We've never had 12 contractors interested in me in 25 years of doing this, so we're trying to figure out whether the industry is maybe turning a little bit, but that was a good development.
I'll ask them and
Okay.
see if they can tell me how many are on the plan holder list. And again, if you're interested, the plans are back here on the table and the spec book's back here as well.
Could you get them to send the current engineer's estimate to Dr. I'm sure we've got that.
Their previous estimate was 1.6, and I think they think it could be 1.7, 1.8.
Okay. So on bid day, they're saying 1.7, 1.8.
And that's
Because the engineer never wants to be the low bidder, not very often. You're not the engineer very long.
well, that's the number that I heard that when we were down there talking that they were anticipating. But again, you've got to keep in mind Davis-Bacon wages have to be included since it's using federal money. Again, if we only have 1 or 2 proposals, it could be higher.
If that requires American iron and steel.
I don't remember. I don't remember that, but
It's federal money.
federal money, I would think so.
Well, I'm gonna get more used to that. It used to drive the cost up. All right, that's all.
Okay. I have heard back from, and you can, from from Josh and Drew, not to go into a lot of personal information since it's a public here, but Josh did have an accident, so that's why he's been held up getting back to me. I spoke to him, I guess yesterday, and he and Drew did send me some dates. I don't know whether you want to look later in August or into September, but the dates he gave me were next week, August 12th, and we'll probably have a problem doing that because we've got a board meeting that day and we've got new teachers here, so we wouldn't be able to do it here. The 13th, which is Friday, or the 17th and the 19th. And we can go further if you want to, but August 17th and August 19th, Tuesday and Thursday the 19th. Or excuse me, Tuesday the 17th or Thursday the 19th. I don't know what your all schedules look like, if you want it that quick or if you want to, and I don't know what John's schedule looks like, and Bobby's.
12th, 13th, 19th.
17th or 19th.
12th, 13th, 17th, 19th. I mean, we had the school board meeting the 12th that morning, we could do something at the county office maybe, but.
Like, I mean,
We tied up most of the day with the teachers.
I mean, I'll be here just to introduce to begin with, but once I'm done that, I could do it later in the day. Really, Ms. Mustaine does.
Only reason I say that is that we're already gonna be knocking the first half of the day off, because it's work for everybody just to go on and keep cranking.
I've got a court hearing too.
Okay.
So I'll be back.
We ain't gonna talk about it.
Well, I'm fine if we do it right after our board meeting.
I think we do it right after the board meeting and see if Chris can get us a.
Well, I'll do it at the tech center if it is where I'll do it. I'll ask Kevin if we can do it in the
That's good.
conference room.
Okay. Does that work?
But I'll have to ask him.
See if, I guess we need to make sure.
I need to check with John and Bobby and John.
If it doesn't work, get Amanda to shoot something back out to us and we'll look at those other 3 dates. I don't know if she won't come back to it Monday.
That's all right, I can. Okay, yeah, we'll look at it, the 17th or 19th would probably be better, but that's, we'll look at those when we get to it. I'll check with Mr. White to verify, see if the tech center can be used, and I'll check with John Lawson and Bobby to see if they're available. If not, then we'll look at the other dates and I'll let you know. You received updates on the 18-19 and 19-20 carryover spending. So you have that information. And I apologize for the confusion of just not carrying that numbers over but we will, as we get invoices for the accurate cost, or the actual cost, we will fill those in and alter that and communicate that with you. One change that, just to keep in mind, I think we talked about already, was the mowers for the 2 football fields. We're actually going to get, there's going to be a little bit, there's going to be a reduction there because the mower at Narrows High School is smaller, so it'll be about $4,000 less. So that'll be about, instead of $24,000, it'll be $20,500 there spent on those 2 mowers for that.
Are we using the carryover money for the carts?
We'll probably use for the carts and for the picnic tables that I shared with you, we'll probably use the CARES money, because that's again stemming from.
Okay.
So that's not included. None of that's included there.
Yeah.
That we'll take that out of the CARES money.
Okay, that's good.
And by scheduling the meeting with Josh and Drew, we'll be able to have a conversation about HVAC for Macy, Giles, and Narrows, which will allow us to start determining how we're going to proceed, what we're going to be able to do, and hopefully be able to whittle down a little bit on, because we've got some of that money in the ESSER 3 funds allocated and saying that we could use that for some HVAC projects, et cetera.
So for that facilities meeting, Terry, how do we loop in the solar folks to figure out how all those two things start to dovetail together. Because there was a component in that would allow us to try to pay for some of those facility improvements, and we need to make sure that Josh and those folks are privy to where they may want to locate some of these on roofs. So I don't know if we get through this first facility meeting and then bring the solar folks in after we've kind of nailed down what we're gonna do with roofs and HVAC. I don't know the exact order.
I don't know what's best. I would assume, and you all can tell me better, I would assume you'd want to have the conversation with Josh and Drew to have a better understanding of what they included, why they included it in the draft plans that they sent us.
Yeah, I mean, I think there's, yeah.
Then loop, Cicerelli's his last name, I can't think of his first name. The group for the solar, then we have a follow-up meeting after that, and then have them as part of that meeting possibly, unless you want to incorporate them in.
I think we need, yeah, I'd rather see, hear what these guys have to say, what their cost is, what their bottom line is, just kind of have that out there, to see what we're looking at when we're talking with solar folks as well, and you know, I think now's the time too, we're going to consider that performance contracting as a potential, and get John Ross to get those folks to come in, because I think whatever decision we make in the next 60 to 90 days on this is going to, you know, that's what we're going to have to hook our horse to.
Okay, so we'll take care of this meeting
Okay.
first.
And I've already mentioned it, but just want to again mention it so you're aware. We did receive the updated flyer for our partnership with the Community Health Center of the New River Valley to have the health clinic at Giles High School. That work is being done now on that room. Looks pretty good. And they have information on their website. This flyer has been posted to our social media pages. It's been posted to the website. So individuals can go to the Community Health Center website. They can go to the Student Health Center at Giles High School on their Patient Services tab, and they can start filling out and completing the printable patient enrollment form if they're interested in doing so. So again, it's dental care available to all students. It's students and staff can access medical services as well. But again, there's an enrollment form if parents want to participate, their child to participate. So that information's out there.
How they handle that over the first couple of months, they'll be their own best or worst advertisers. Because if it goes well, then people say you need to go down there. It's a great program. They take care of you. It starts going in a ditch. That's just how. I'm sure they understand that.
Yeah.
We don't have the ability to push that on people, so it needs to speak for itself.
A question real quick, getting off track. Will the 8th grade have the orientations at the schools this year and kindergartens and all that?
8th grade's gonna have an orientation.
They'll all have that this year, okay?
On the 19th.
Okay.
That's on a Thursday this year.
Is that?
8th grade orientation on Thursday, and then open house that evening, right?
Yeah,
Yeah,
19th,
and everyone else has
Thursday.
open house that evening.
Do we say virtual for that, or are we doing it
No,
in
we're
person?
going in person.
Yeah.
You'll be in person.
I've got one in kindergarten.
Some of the schools may try to move like their teachers outside, you know, if it's pretty that evening and, you know, stuff like that, and then take tours or kind of spread it out, but it's gonna be in person from
'Cause it's
1 to
kinda-
7.
It's hard to determine how many people we're gonna have there, so.
Yeah.
They're gonna have to build her a special room.
So,
Oh, come kick me out.
I had one more thing, Dr. Arbogast, something, that's probably been itching with me for several years now, and I've talked to one of the athletic directors about this. I've actually talked to some county board members about it. I would like for us to seriously consider offering free passes to all students to get into sports activities. I think that is a tremendous opportunity to try to keep as many kids as possible on campus in a social setting. I can't tell you how many parents I know that there's no way they're gonna pay 3 or 4 kids to get into 3 basketball games in 1 week. Giles, athletic director, obviously was a little bit nuts when I first talked to him about that, but what I told him is we would consider this maybe a pilot year, and if they track that they're hurting by X amount of dollars because we're letting these kids in, then we'll find a way to make that up, and we'll figure out whether that's gonna work or not. I will tell you the 2 board supervisors members have told me that they think that's a tremendous idea, and if we needed help, they'd try to pitch in some as well. So,
What age are we talking about?
I'm talking about if you're a student in Giles High School,
No, Giles High School.
no, Giles Nares,
Giles County.
Giles County.
yeah, Giles County,
But-
you're talking pre-K-12.
all the way through.
That's what happens, you're talking pre-K through 12, I'm assuming.
I tell you,
I'm just, as a point of discussion, I want us to just talk about pros and cons and maybe not we can't claim in all these meetings that we live in a county that has fixed income and has a hard time making it, and then turn around and ask a mother of 4 to take their kids in to 2 or 3 games a week. It's not, they can't do it. I mean, I think it would increase attendance at our sporting facilities and give the kids something to do besides maybe being in a bad environment. Up for discussion. I mean,
I'd like to talk to Mr. Lowe and folks in there, see how it's gonna affect their budget. Talk to some of the folks on the board of supervisors, because, you know, I don't wanna put our athletic programs, I mean, I think communities do a good job supporting them, both through ticket sales and through donations and advertising and everything they do. Because God knows I wrote a bunch of checks the last couple of weeks for both schools, but I just wanna make sure that that's, you know, we're not putting ourselves in a position where, because I think we provide a lot of support to athletics, but we also, you know, if we're committing to make up a deficit that's caused by this, that's something we need to look at before just saying, hey, that's great, let's let everybody in.
if there's any year we can try it out and see what the impact of the sports program may be this year, next, and even the following, we have the ability to reach into some buckets that we normally wouldn't have. And as I said, 2 board members, board of supervisors members said they fully support that, and if they needed to share some of those costs, that they'd be interested in doing that. So I just, the more I think about how kids, I mean, they'd love to be able to stay on campus and stay and go to those games, even if they can catch a ride with a buddy. To get there, all they gotta do is show up. They don't have to have $5, they just show up and they can get in. If you're a student, that's one of the things that you get the benefit from. Maybe we find out that financially that's not possible. I know City of Radford, their council writes a check every year and says we want every kid to have that opportunity, and they don't, not one of them pay to get in. Essentially, we would ultimately maybe be leaning towards that
Well,
kind of supplement. I don't know I don't know how bad it'll impact till we keep track of it 1 year.
well, I think too, I know with these athletic passes, family passes, I think there's some student passes that they've got that, although it's a cost, I do think you've got a more economical option than paying at the gate every time. But let's look, I mean, I'm not opposed at all looking at it and talking about it, but I think we've gotta, loop the athletic directors in, loop the principals in, and also get a full commitment from board of supervisors. At a time when we've already just talked about asking them for money for teacher compensation,
Well, it's work session discussion.
I look at it like this, as a supervision. And I've been in that role where you let them off at the gate, and that's when it was paying they go in. And you've got 300 kids, they ain't watching the game. They're up in the trees, they're playing, they're up on the hill, they're doing that. And you're responsible for them, and you're breaking up fights and this and that, because they're let off for 2 or 3 hours. And they're all over the place. I can't imagine supervising them if they don't have to pay to get in, how many kids you're gonna have.
So
Whether that's wrong or right.
So we're gonna reduce opportunity based on income? Is that what we're talking about, Bill?
I don't think it said that.
I'm just saying,
I don't think it said that at all.
because now we don't make them pay, they're gonna come out of the woodworks.
You're gonna help them supervise.
I'm just telling you.
I just don't think it,
Okay.
I just don't think, it's hard.
It is a point of discussion. I think we do need to reach out to principals and athletic directors.
Sure.
And just talk about it. That's all.
I think we need to let them decide, what's best for, their budgets, and whether it's certain people, but I don't think we could micromanage, and, maybe we can, I like your idea, but I just don't. I don't think we should mandate that, we should let them decide.
We're gonna let them decide not to let elementary teachers in. We don't wanna do that either. Sometimes we gotta push the bar a little bit and get a little change, and change is not always super popular. I'm just always thinking of things that might make our kids have a better opportunity not be stuck in an environment they shouldn't be, or playing video games. I mean, when I was a kid, we didn't pay to get in, and we went to every event we could get to because we'd rather be there than at the house. You can be with your buddies, you can be around teachers that maybe are good mentors for you, and I'm sure on the other end, Mark, you're right, there'd be maybe challenges with having more than staff could take care of. But maybe we start with just high school students, I don't know. But I'd like to have some behind the door conversations with the folks that would be impacted and keep that conversation going. That was just something I wanted to bring up while we're in work session, so. Do you have anything else, Terry, that you want to talk about putting on the agenda for the meeting?
Tell them what you think, you can say.
I think you need to try to see how much it's gonna impact.
I just don't know how we do that until we go through a year and see how many are short. You'll never know. I mean, the other way would be trying to figure out how to buy $35 passes for the kids who say they can't afford it.
But do we keep I think NARAS charges like a student ticket, I think it's a adult rate and a student ticket rate or something. You might be able to go back and look and see how many, I don't know, I don't see that.
I think the Giles student year-round pass is $35.
Well, what I'm saying is, you look at that number, then you also look at, I think there's a different ticket charge for, a different age. I don't know if it's like, because I know if they're under pre-K, they get in free at least the NARAS football games. At least they did a couple years ago. And then I think there's a student ticket price somewhere in there. I don't know if that's elementary or if it goes on to high school, what that is.
And if their parents are with them, they get it free. Hey, so
I don't think you're gonna go from 50 regular people that's comes to a ball game every ball game to 200. I don't think it's gonna happen. You're gonna gain a few, but you're not gonna gain that many. Most people it's gonna help out is parents that has smaller kids, that has a kid that's playing high school sports.
Yep.
You got 3 or 4 kids, you know, like Stevie said, you go to a basketball game at least twice a week.
I don't have a problem with that, hey, if we can, you know, somebody can help
But
with
your
the
student-
schools.
But your student kids that come to the ball games, you might pick up a few more, but you're not gonna get a tremendous
If
amount
you
more.
drop them off at just a babysit, that's where you got the problem.
Well, there,
If they wanted that, they'd find a way to get $5 for a free babysitter and they still drop them.
and most of the people's gonna fix your high school students anyway. And they're gonna find a way to go anyhow, whether they pay or not.
It's the same way with the mask, and you can't just say, okay, if you're a single parent or even a 2-parent income that has 3 or more kids, then your kids get in free. You can't do that. You're gonna have to say that the kids get in, and then we'll have to see how much that impacts, but I think your recommendation to have some discussions is perfectly,
Yeah, we can have,
one way to go.
we can have a conversation with principals, we can start that conversation. Ms. Mustaine has meetings with ADs, she can start that conversation with them as well.
When you have a lot on your plate, so certainly do not put that at the top. That's just something I was kicking around.
They we wanna answer tomorrow.
Well, we'll actually.
We do have a meeting tomorrow.
We got a meeting with the principals, be here, we'll start that conversation, they'll at least hear that and let them an opportunity to talk about it, so. I don't know that we'll have a big conversation about it tomorrow, but at least give them the opportunity to think about it and go back and get information together.
Tell them that Mark asked about it. Don't use my-
And you wonder why you're never invited to it.
If you want to, love me if you can. That's all I can.
Expecting that check like a lost revenue.
I think they invited to the golf.
I didn't either.
Yeah, right. Is there,
I'll make sure,
They probably see me golf though.
even you can have a whole sponsorship for a nice bargain price. I'll get legal aid.
can you find out what that is for me too?
I will, but I don't.
Send me a flyer. We got any voting items on the agenda coming up, Dr. Arwood?
I don't know what's gonna be on the agenda, to be honest with you, that you all will be voting on. I mean, you'll have some staff members to approve.
Sounds like we can't have nobody approve.
Policy is the only thing that I was curious.
Teachers.
You'll have, you've got you've already approved the stack of policies, I think, the last couple of meetings. I don't think there's any policies that you're gonna see.
Okay.
I could be wrong, there might be 1 or 2, but I don't think you're gonna have a great deal of them.
Be done by 8 o'clock.
I would think 7:30, we're actually gonna be a little bit longer than that because we got new teachers that are coming in at 8:30. So we'll let the new staff introduce themselves to you, let you introduce yourself to the new staff, and then shortly after that, probably, I would say 8:45 to 8:50, we would be done because they'll get started right about 9. I'll get them started, and then we can go have our meeting about 9:15, 9:30.
Do we have any reason to go into closed session? Anybody got any personnel? No? You got anything else, Dr. Arwood?
No, sir.
Everything's looking good on the administrators, everybody's on board, everybody's raring to go.
Doing fantastic,
Very much so.
They're doing really well.
Things going well.
Very pleased.
Look forward to having everybody up here tomorrow, administrative wise, and really get kick the gear off, get started. Next 2 days.
Mr. Webb?
Move to adjourn.
Second that.
Motion second. All those in favor?